There are some big changes coming to Medicare in 2025, but the question is which ones are real changes and which ones are just fluff. So in this video, let's talk about what those big changes are and which ones to pay attention to and which ones are a little bit misleading. Again, I'm Emily with the Medicare Coach. We are an independent Medicare consultant helping our clients easily navigate the Medicare rules and the insurance company overwhelm to help them do what's right for them to protect their financial savings while still having the best health insurance, the best health coverage possible. So let's go ahead and kick off and jump into the changes happening in 2025. One of the most straightforward changes is that the Medicare Part D maximum deductible is increasing to $590. This is a pretty normal increase. So why is this important? This is important because when it comes to all Medicare Part D drug plans, Medicare sets the maximum amount that a deductible can be for any Medicare Part D drug plan. Again, copays tend to be higher before you ever hit the deductible. So the most, at least as of now, that the deductible can be for Part D in 2025, it's $590, which is up from $545 in 2024. Some plans, though, will have a lower deductible than this, but it cannot be higher than the Medicare set limit. So that's a pretty straightforward change. That's at least good to be aware of. Now, the second change that we're seeing is a bit more significant, and that is the annual out-of-pocket costs will be capped at $2,000 for out-of-pocket, again, out-of-pocket medication costs for both Medicare Part D as well as Medicare Advantage plans. And this can be really important for those of you who do have expensive medications. Now, hopefully you're watching this and you either take no medications or really cheap generics. But I had a client the other day whose medication was going to be over $1,500 a month for the first 2 months on Medicare, and that can be a lot. So it is nice that Medicare is capping those out-of-pocket costs for your prescription drug plans. But I want to keep a few things in mind. Number one, this $2,000 cap only applies to your medication copays. It does not include any of your premiums. Number two, it only covers medications that are covered by your prescription plan formulary, the prescription plan covered medications. It does not cover your Medicare Part B medications, right? The one administered by medical professionals or any other medication not covered by a Part D drug plan. We tend to see that with things like certain hormones or compounded medications. So this $2,000 cap only applies to medications that are approved, that are covered by your medication, by your Part D or your Medicare Advantage drug coverage, okay? I want to highlight that because, Medicare Part D or even Advantage plans are not required to cover all medications. In most cases, a Medicare prescription plan must cover at least 2 drugs in any given category. Now, there are certain protected classes like organ transplants, HIV/AIDS, antidepressants, seizures, cancers, things like that, where they have to cover more of them. But I highlight this because there could be a case where Part D plans might drop certain medications in 2025 because they have to work within inside this $2,000 cap. So we're watching to see how the formulary will actually look, but it's something to look out for because just because your medication's capped at a cost, there's a chance that your medication is no longer covered on your plan in the upcoming year. So be aware of that. Again, this also applies to Medicare Advantage, Medicare Part D, as well as Medicare Advantage. One final thing on this piece is while the cap is $2,000, this cap can increase in subsequent years. So just because it's a $2,000 cap in 2025, it will likely be higher in 2026. So it's not a forever cap, it's a for right now cap. Okay. Now, the next thing that we're seeing in 2025 is the elimination of what's called the coverage gap, more commonly known as the donut hole. And I think this is an exciting thing for people because the donut hole tends to have higher copays. So it's a great thing that the donut hole is going away conceptually. My question though still is, well, what does that mean? Because I think at the end of the day, we all know that insurance companies will make money one way or the other. And so if we don't have the higher copays and the coverage gap to help cover their costs, what does that really mean to you as an individual for your prescription drug medications? Now, I'm optimistic that overall your medication costs will go down, especially if they're more expensive. But I think there's a good chance that maybe the generics get more expensive and the name brand get cheaper. Again, we'll know more come October when the plans are announced. But I think a key takeaway is that the coverage gap, the donut hole is going away in 2025. What that really means for you in your pocketbook, I don't know for sure because we don't have the plan details, but we're watching it very closely as it is a significant change to Part D drug plans in 2025. Right now, before you hit the deductible, you're usually responsible for 100% of your copays. That will stay the same in 2025. You're usually responsible for 25% of your copay in your initial coverage level. But then again, the donut hole goes away. And so there are some costs in that donut hole level that will disappear once this goes away in 2025. The question though is is that money going to be put somewhere else into other levels when you ultimately pay out of pocket for your medications? We'll have to wait and see. Another change I'm excited about when it comes to 2025 is what we're kind of calling payment smoothing, okay? Medicare is allowing a payment plan option to smooth out the costs into monthly installments. And there's no limit on what your income is to qualify for it. Everyone qualifies. So again, I have a client right now who's paying $1,500 for the first few months when she's on Medicare for her cancer medication. And this payment smoothing would be nice because we can actually spread out those payments across multiple months. And so you can enroll in this payment smoothing at any point in time. The Medicare is, as I'm recording this in the summer of 2024, they've not announced the details as to how you enroll in it, but they're telling us that you can enroll in the smoothing either in December, let's say, or when you enroll in the Part D plan, or at any month during the year. So again, these will only cover your medication copays. It will be ran through the Part D company, where again, you'll sign up, you will pay the company the monthly payments, and they will pay the pharmacy when you get your medications. But the details are not laid out. I think when I read this, I think it looks a lot like zero financing of your medications. And to me, I don't know of anyone in this current interest rate market who would actually offer zero financing. And so I want to see the details as to what it truly looks like and what it means as a person. I love this idea. Practically speaking, I'm a bit skeptical, and I do want to see the fine print and how it would work. So conceptually, how it's going to work is that when you either before you enroll in Medicare or once you're on Medicare and you get a high medication cost, you could enroll in this plan. So our intention is that when we see a client with high cost plans over, say, $1,000 a year, it's a little lumpy in the early months, we will reach out to them and say, do you want to enroll in the payment plan smoothing? They can always enroll later if they want to. But if they do enroll in Medicare, and let's say that their costs are going to be, $1,000 for January and February, and then nothing else later on. If we were to do payment smoothing, those costs would be around $166 a month for all 12 months. So you have to stay in that Part D plan to be able to do that. And there's not clear terms as of yet as to what happens if you leave the Part D plan. Do they charge you interest if you leave? What happens? But I think my key point is that we will be offering our clients, we'll be recommending our clients to at least consider this payment smoothing when they have high medication costs, and it can even out the payments throughout the year to avoid that big hit on the first month or two, okay? Another change in 2025 is around the Part D premiums. And to me, this is a bit of fluff from what I'm seeing. So the Inflation Reduction Act prevents Medicare Part D base beneficiary premiums from increasing more than 6% each year. Now, I want to note here that the base beneficiary premium is not the same amount that you actually pay in monthly premiums for your Part D coverage. So there are two different premiums, and this doesn't really apply to you. So the law did not cap the growth in individual premiums to 6%. It's capping this base beneficiary premium to 6%. So I think this is a bit of fluff from an end user standpoint. I can't guarantee our clients that their premium will only increase 6%. So I think it's really important that we watch this as well. We watch all of these things because at the Medicare Coach, we are a huge advocate of finding that best plan for you. And it's usually more than premiums and deductibles, right? We want to look at all the copays, the preferred pharmacies. We want to look at all those levers that we could possibly pull to at least understand what is the best option for you to save yourself money while still getting your medications. Now, the final thing that we're kind of seeing in the new year is that there are some companies leaving the market, changing the market. So Mutual of Omaha, at least as of now, has said that they're no longer going to offer Medicare Part D drug plans in 2025. So if any of you have a Mutual of Omaha plan, you should be getting a letter in the next few months saying that they're no longer offering a plan and you have to find a new plan. So look out for that letter and be thoughtful. I'm not really worried a ton about Mutual of Omaha leaving the market for Part D. This does not impact their Medigap or their Advantage plans. It does only impact their Part D plans, but it's something to be aware of. I was golfing with a guy the other day who has been with Mutual of Omaha for 30 years, so we just happened to pick their Mutual of Omaha Part D plan. So I said, hey, Bob, like it's going away, like heads up. And so if you don't know it's coming, it can be a little bit of a surprise, but this shouldn't be a big deal for Part D. We are also seeing that Cigna sold their business to Healthcare Services Corporation. Probably not a big deal either for 2025, but we are watching it to see if there's long-term implications. So those are kind of the big changes that we're seeing throughout the year. If you're new to Medicare and all this was Greek, start off with my free workshop, which I have in the link below, or other free resources that I have down below. If you're already on Medicare, I hope you found this helpful. Again, if you're on Medicare from October 15th through December 7th, you can change your Part D or your Medicare Advantage plan. Last year, our clients on average saved $2,200 for the calendar year of 2024. So these changes I expect to be quite large as well for the upcoming year. So please be thoughtful, review your plan, get the right plan for 2025 to ultimately save you money. Okay? Again, I'm Emily with the Medicare Coach. Check out the comments below to get more resources for free. And if you liked us, make sure you like this video and give us a comment down below. All right, thanks for being here, and here's to help you easily make your right Medicare decision.